Good day, everyone, and welcome back to my channel. We had a wonderful time last week, and today I have come with another important topic. But first, I would like to say a welcome to all of my existing viewers, and for those who are joining us for the first time, welcome as well. Please kindly subscribe to this channel and as well like this video. You can also share with family and friends and leave your comments in the comment section for any questions that you have. So let's delve in right to the topic of today. Today's topic, I'll be speaking on flossing. My previous video spoke about the harmful effects of the use of toothpicks and other objects in cleaning between our teeth and other areas of our mouth. Today, I'll be talking about a safer, healthier, and more convenient way of cleaning particles from between our teeth and around areas of our mouth where our toothbrushes can't reach. So please keep watching and I hope you learn a thing or two from this video. What is a dental floss? A dental floss is a cord of thin filament or a thread-like material that is used to clean between our teeth or hidden corners and areas of our mouth where our toothbrushes can't reach. So rather than making use of a toothpick or needle or matchstick, it is advisable that you make use of a dental floss. The use of a dental floss is easier, way convenient, and safer to make use of. So what's flossing? Flossing is simply the act of using a dental floss. So dental floss is the material that you use, while flossing is the act or the habit of using a dental floss. Now, many persons brush their teeth regularly, morning, night, as many times as possible. But most persons fail to floss their teeth. Yes, it's good to have a good oral hygiene by brushing regularly, but it would not be complete without flossing. Flossing, like I said, is the process of cleaning between your teeth. Your toothbrushes cannot do the work of cleaning between your teeth or hidden corners like your posterior and molars. That's why it's important to make use of a dental floss to get rid of those particles, food debris, or plaque they may have clogged between your teeth or around those hidden corners of your mouth. So I'm going to speak briefly on plaque just so that we get to understand better. I don't know if we've ever noticed the yellowish, whitish, or sometimes colorless substance that hangs between our teeth or below our gum line. Yes, so that is called plaque. It is actually a bacteria containing film that is developed over time as a result of food packing and bacteria acting on those food. Now, if it's left over time, it causes pressure on the gum and it causes the gum to inflame, and it could be reddish, painful, and sometimes sore. And if left without attention, it could result to what we call tartar or calculus, which is the harder form of plaque. Now, when plaque is at this stage, whitish or yellowish, it could be removed with the use of a dental floss, thereby reducing the risk of cavities or other gum infections. But if not, it proceeds to what we call the periodontitis and other higher gum infections. So this is what plaque means. Another reason why we floss is because we hope to remove bad breath causing bacteria that your brushing alone cannot remove. Now, I have mentioned plaque. Plaque contains bacteria, and some of these bacteria are able to cause bad breath. So taking out this plaque and taking out food debris from between our teeth and other areas of our mouth helps in reducing bad breath and also helping us to maintain a good oral hygiene. Flossing also helps to reduce the risk of having interproximal cavities. Now, not until when cavity is formed on the surface of the tooth do you agree you have cavities. Sometimes cavities can be formed between your teeth, known as interproximal cavities, and sometimes these cavities cannot be seen with a naked eye but with the aid of an x-ray. So to avoid having interproximal cavities, it is advisable that you floss your tooth regularly. Lastly, flossing helps prevent gingivitis, which could further lead to periodontitis and tooth loss. Like I said, plaque formed between teeth and around the gum line could add pressure and cause an inflammation on the gum, which is known as gingivitis. Gingivitis is simply gum inflammation. So it causes the gum to be inflamed, reddish, swollen, sometimes painful and sore. And if it's not taken care of, gingivitis can further progress to periodontitis, which is a more higher gum disease that could cause one to lose their teeth. So we don't want it to get to this point. So this is why we say it is important that we develop a flossing habit so as to maintain a healthy gum, healthy teeth, and a beautiful smile. So we're talking about the different types of floss that we have. So floss can be picked based on your tooth space. Now some persons have thinner spaces, some persons have larger tooth spaces, while some persons have pretty tight spaces. So it is not good when you have a tight space and you're going for a very thick floss. So when you have a thinner or very tight packed spaces, it is advisable that you go for a thinner floss. That way you can conveniently and safely clean between your teeth without causing harm to your gum or your tooth. We also have the super floss, which is most beneficial to persons with orthodontic appliances like braces or bridges or crowns, or persons with wider spaces. So this is convenient for persons with this appliances. Another type of floss is the regular kind of floss that everyone knows about. So this floss comes in flavors. Some come waxed and unwaxed, and some of the waxed comes in different flavors like strawberry, mint, etc. So if this is a good choice for you, you can go for this as well. We also have the floss picks. Now, this is the more conventional one that you can take with you everywhere. It could be in your handbag, in your purse. You can make use of this in the restaurant or at work. This your get to go floss because it has the handle that is convenient, unlike the other ones that you have to wrap around your fingers. So this is also a great choice for anyone at all. We also have the water flosser. This is a very good method as well because it uses water pressure to remove food particles stuck between our teeth. Now, this is also a convenient choice for anyone at all, but it's often recommended to persons who have poor manual dexterity or aged men and women. So if you feel that this would be a good choice for you, you can as well go for it. So these are the various types of flosses that we have. So make your choice or visit your dentist to get a better opinion. And yeah, keep smiling. Persons often ask the question, what is the ideal time to floss? Ideally, you're to floss after each meal, but because of our activities, work schedules, we are always up and about. Sometimes you skip this part. So that is why we advise that you floss at least once in the day, preferably after dinner, just before you brush your teeth at night. It is good that you floss so that you can take away any food particles that may have accumulated during the day. In conclusion, flossing should be that one habit that we develop to help us have that healthy gum and teeth that we desire. So the write up here says brush, floss, rinse, and repeat. With doing this daily, you are one step away from teeth issues. So that's it on flossing, and I hope you were able to learn something out of this video. Thank you for staying to the end, and I hope to see you in my next video.